Good afternoon to all of you. I think after this lunch, I don't know, let's see if I can keep you awake. First of all, I would like to thank Mr. Rao for inviting me here. And I have known him very little time, but the very little association what I had of him, a great hats off to you, sir, for making this such a big, huge success. Let me start. I start with the aging scenario, which I think you must have heard again and again in every conference. But I'm not going to stop at this. It is just an introduction to see how are we going to tackle this rather than talking about the problems. Now, just quickly, I'll go through this. You know, I don't want to say this is the fastest growing segment. And by 2050, the number of young and the old will be the same. And the elders population is around now 8%. In Bangalore, it is estimated around 9%. And it is estimated to grow by 2025 into 168. Again, I don't have to talk about the factors because I have not taken the other two factors about spiritual and financial. It's just I've taken it under the social and emotional and the physical. Now, when I talk about this is how do we do this? We have been talking in great depth about what is social problem, what is emotional problem, what is physical problems. Now, when you say physical problems, we are going to talk about a few things like normally people immediately think about health. So let me go with health and how do we overcome this. Access to health care. The elders find it very difficult. I know we're not able to access, everybody cannot access this. Affordability, I don't have to talk about it, is because the spiral costing of the medications and the cost. Increasing disability, yes, there are not enough people to take you across to the hospitals. Ambulation difficulties linked with the same thing. And the paucity of or poor geriatric services, because still people have not got up to providing these services. And we are lacking in elder-friendly features. When it comes to emotional factors, respect and dignity, the self-esteem of the older people has gone down. They are not involved in any decision making, and they are not, though they are part of the integral part of the family, they still don't feel this. And elder abuse, they've been talking again and again about it. Now, what are the social factors? The perception of the elderly. If you see the news media everywhere, none of the projection is about the elders. So there's reduced participation, the family disintegration, the financial instability again, which is a great problem, separation from the families, shrinking social network. Now I stop at this is to say problems are galore because the population and the fastest growing asset and what the problems are also equally that much. But we cannot wait at this. The state government has to pick up the community, the NGOs, the family itself, and the senior citizens themselves have to look into how are we going to tackle this situation. Now, when I talk here, is only I can talk with my own experience of a model. What we have created to address all these issues. Now, all these models which we have created is a sustainable one, which is acceptable and affordable, and will look into all these issues. And we also have to look into the lower socioeconomic groups and also the rural people. Okay, coming to health. Home care, day care, and residential care. Now, why do I start this is because 15 years, 16 years back, I started this home health services, providing medical services at the homes of the elderly, because we know that going to the hospital, traffic woes do play a great role because many of them do not want to access it, do not want to go to the hospital, is because there's nobody to take them there also. Long waiting queues and chronic disabilities can be easily looked at the homes. The treatment can be done at homes. So when we started this, we were able to provide the doctors at home, the nurses, the paramedical staff, the physiotherapists, the lab technicians, and now we are looking at around about 5,000 families. Now, I'm not talking about numbers that what I am doing or what I have achieved. It is just to tell you that this is a great need at this time. So hospitals, I don't say it should not be there, but home care, I'm sure senior citizens do need it very much. At least I think many of them have to start this, and in many cities, so that this particular problems of the health, which is accessible, affordable, and acceptable, can be done. I have seen many of my patients say, I would rather pass away at home in a situation where I am comfortable with. Now, daycare. Now, when I come to home care, this is what I was trying to tell you is increased acceptance. That's why more and more people are opting for this. So these are our services where you see the nursing care at home, care at the door. They're the preventive health care, care for the chronic illness. Many of these illness can be treated at home except cardiac cases which we are not able to manage. We take an ECG and try to transport them as quickly as possible. Daycare. Now, daycare concept was very new when we started it about 12 years back. It's more an enrichment center where people meet, and you have not only specialized healthcare services provided there, like preventions of falls in the elderly can be addressed in the daycare centers. It can be recreational and cultural there itself. When you talk about midday meals and nutrition, I'm not talking about for the higher socioeconomic group. I'm talking about people of the lower socioeconomic groups wherein nutrition is provided. And daycare centers are very popular. I believe that the elders should be a part of the family, and the responsibility of the children also should be there. I'm not saying old age homes should not be there at all, but I feel daycare centers have to be promoted in a bigger way. So this is for one of our daycare center, which is for the lower income group, where you see people are also generating income by making paper bags, the plates, the paper plates, and also the aracanut plates. So not only that, there is a sort of an empowerment of these elderly. So you sell these things and get them some money. So when you look at this, the health-wise and the emotional-wise can be addressed in daycare centers. Now, there are specialized daycare centers which we have developed because earlier when I used to go to the houses of the people as a medical person, I used to see between 65 and 75. Now I see most of the patients in the 80s and 90s. And what is that is dementia is on the rise. So we felt we have to also address it not only by home health services, but by also setting up dementia daycare centers. Many people do not want to put them in the residential care. So for this, we have about 2 dementia daycare centers, wherein the people come there and then go back in the evening. We are able to provide different activities and see that their nutrition and they are kept better, so that the behavioral disorders as well as the progress of the disease is stalled. I'm not saying it's reversed, but it's stalled. And we have had a good experience of this is because many of the drugs have come down, and also the behavior is much better when they go back home. Now, when it comes to residential care, I know there is a lot there are old age homes. I'm not saying there are not old age homes, but when I say residential care, it should be a comprehensive one, where everything is provided. A daycare is provided, respite care is provided, a short-term care is provided, under one roof. So this saves the person for not traveling from one place to the other. Now, when I talk about this residential care, we have a specialized residential care for dementia, a 80-bedded facility at Kasturi Nagar, wherein it's a comprehensive center where you'll find all of them under one roof. So the dementia patient hasn't had to move from one place to the other. This is one of the models of aging and Alzheimer's. We also admit few of the Parkinson's patients here. When you see the services, assessment goes on, a short respite care, a day care, and a long-term care. So this, in short, was that the models what we have created is one which is it's sustaining. We have proved that it could be helped, and if it is replicated all over India, I'm sure many of our health issues would be addressed. Now, the outreach programs. Now, we do not stop at residential care or daycare. We also have to reach the community. So how do we do this? By either screening or creating awareness. Now, specifically why I'm talking about teledementia is we are not able to do it with the telemedicine. So we are able to do with the teledementia. We are able to connect and see that more numbers are approached. Now, we are starting one of a low-cost dementia center at Kolar, wherein we are connecting this teledementia, which probably would save much of our psychologists and the psychiatrists to be moving up and down because Kolar doesn't have so many of them. The rural mobile medical care, which we tried out, is for about 25 villages, where in preventive medicine we tried. I'm not saying we're doing big things, but still preventive medicine and awareness of various disease does help. So been telling everybody that the state government and the thing to have more mobile medical units in the districts. I'm sure state of government of Karnataka is more amenable to this particular idea. And so this, especially because they are not mobile, I think this helps a lot. So we have periodical health camps and awareness and screening. Now, what about ensuring well-being of the emotions? Sir, time, tell me the time, if I'm running late or wrong.
Another 3 minutes.
Another 3 minutes. I run quickly. The 1090, what we thought is we approached the police and said that we would address the elder abuse by taking their premises. Now we are situated in the police commissioner's office, which adds a lot to the elder abuses because there is some sort of a pressure on the opposite party to come and solve the problem. Especially, I have seen nearly about 57% of the problems which come in the elders helpline is because of intrafamilial and property issues, which is quite shocking. This not only mitigates loneliness and adds purpose to their life also. It also adds purpose to their life. Here, legal services and all the services are free. This addresses not only the, ensures not only the well-being, it also gives a lot of information which these elders are seeking for, especially for caregivers. And this is one of the centers which anybody could approach. Now the Government of India is already thinking about the helpline, not only in the national level, but also in the district levels. And I'm sure it's a welcome because definitely all of us do need the service. This is the elders helpline which has been running. Not only stops at for elder abuse, but also for advocacy and awareness and how to be for safety and security. The Elders Enrichment Center, which I was talking to you for the upper socio-economic group people, which enriches them and they do not, and they feel quite comfortable rather than wait for doles or asking for concessions. Especially between people between 60 and 70 are capable of working, and I'm sure tapping this resource, we would be able to go ahead with at least looking into the financial aspects of it. So this is Job 60, wherein even the vocational training is done, and many of them have been able to sort of get some meager income during this time. When I say they're getting jobs, I'm not talking about the high, it's in the range of say about 12 to 15,000, not more than that. That's what we are able to place. We have not gone in for the people who are capable of getting much more. So what is our thing is to just to add colors to the gray years and to see that they are happy, healthy and secure. So thanks a lot for this, Mr. Rao. Thank you so much.
Before I allow others to ask a question, Madam, can you clarify on the daycare procedure? Because we too also run in care hospital in Hyderabad daycare services. That means upper limb fractures, appendectomy, lap chole, which can be operated in the morning. By evening, by 7 or 8, the patients are all discharged and the setup is locked. That is called daycare surgery.
There's a slight change. This daycare, what you're talking about, is completely focused on health, whereas I'm talking about the emotional aspect of it, wherein it is looked into.
Okay. Anybody else wants to ask a question? If there are no questions, please.
For the time being, we are using the MMSC, but there's been a lot of work doing in about the, especially for the rural area, wherein there is a lot of adaptation, but we are doing the translation into Kannada and Tamil and all that. I know it's very difficult. What you ask is right, is because they do not understand many of these questions, but we are trying to sort of make a study, and we still haven't done it, but I'm sure coming years we'll definitely have something like the MMSC soon for the rural population. Thank you. Yes.
How do you define elders abuse?
I don't have an exact thing here, but anything, both emotional, physical, could be abuse. It doesn't mean that you have to be beaten up or anything like that. Emotionally at home, if you say, please just sit in a corner, you don't come back and I'll do what I need it to be done. Please do not get into these. That itself is an abuse. So it could be emotional abuse. So the proper, what you call as, I think Mala will be able to tell you later what exactly the thing of the content of an abuse is. But for the time being, I can tell you it could be both physical and emotional, which is actually in Bangalore, if you see, I heard, or it's projected about 40% of them are abused in one way or the other.
No more abuse on this topic. Can I? The time is short.
Yeah. Latest position. There are people who are holding this Swayamvaras and all those sort of things. I think especially for somebody from Gujarat is doing this. I can give you the address. Probably you can attend one of these.
Thank you, madam.
Thank you,
We'd like to thank Dr.Radha.S.Murthy, Managing Trustee, Nightingales Medical Trust, Bengaluru, India. Thank you so much, ma'am, and may I request Dr. Arora and Dr. Rao to kindly honor Dr. Radha.Murthy.
So do you have that remote?
Thank you once again, ma'am.
tackle all this.